So in summary, if you want to self-manage and fight back against chronic inflammation, oxidative stress, mitochondrial failure, and you want to feel better and have less symptoms from arthritis and connective tissue disorders, get good sleep, avoid stress, try to incorporate the Mediterranean diet into your life, which will help with weight loss and avoiding insulin resistance and metabolic syndrome. Exercise, which we didn't really get into too much in this talk. And personally, I think you should still take antioxidants and natural anti-inflammatories. All of this is going to be discussed in Bone on Bone, which is available this month. It's getting published this month. It's available for pre-order now on Amazon.
Amazon, Barnes & Noble.
And Barnes & Noble, actually. So antioxidant therapy, I take antioxidants every day because I know being surrounded by pollution, having mental stress because my job is stressful, and not having a perfect diet, I'm producing too many reactive oxygen species for my system to handle, so I take antioxidants to help that. And this is due to excess nutrient processing and often just due to lack of cofactors. For instance, 60% of Americans are magnesium deficient. Magnesium is a cofactor for hundreds of enzymatic reactions in your body. A lot of us are zinc deficient. Zinc is a cofactor for hundreds of processes, so on and so forth. So I try to give my body every single micronutrient possible so that it functions at an optimal level, and hopefully I'll have a great health span. I don't want to accumulate reactive oxygen species because they cause lipid peroxidation, which is when you damage the fatty cell membrane. It disrupts the cell membrane, which means none of the channels and receptors will work right. It causes proteins to misfold or unfold, and that's not good. And then it damages DNA. So I want to collect all these extra reactive oxygen species that are excessive. Now some are normal and some are meant to be there. I'm talking about the excessive ones. And then I want them to be neutralized by antioxidants. So I try to eat as many fruits and vegetables a day, but obviously 9 is a lot when you're super busy. So I take supplements, yes, antioxidants. And then dietary polyphenols and HA have been shown to be useful in many studies. And we're starting to learn more and more. But again, it's almost impossible to study a healthy person completely. And then when you look at single molecule studies for like looking at vitamin E or looking at vitamin C, they're very short-term studies and they don't talk about any other aspect of the person's life. So I'm just going with the common sense that if you are healthy and you eat right and you sleep well and you take healthy supplements, you're probably better off than not. But are there great randomized placebo-controlled double-blind studies to prove that? No. But are there tons of studies looking at the Mediterranean diet that show overall much better health and happiness? Yes.